Hello, my name is Hannah Gump, and this is a PSA on HIV. HIV stands for Human Immunodeficiency Virus. This virus weakens the immune system of an individual and causes them to lose the ability to fight off infections and diseases over time. HIV can be spread through certain body fluids, including blood, semen, rectal fluids, and breast tissue. The Center for Disease Control and Prevention reported that in 2017, 38,739 people were diagnosed with HIV in the U.S. Unfortunately, over the years, many myths and stigmas associated with HIV have developed. Some of these myths include HIV is a death sentence, HIV is untreatable, if an individual has an undetectable viral load, HIV can still be transmitted. Homosexual men and individuals who share needles are the only people at risk for contracting HIV. It is easy to tell if an individual is HIV positive. Only those who are high risk at contracting HIV should be tested. And if you have a partner who is HIV positive, you will also get HIV. All of these myths are associated with lack of education and lack of awareness of the disease. Unfortunately, stigmas and myths associated with HIV prevent advancements in early diagnosis and early treatment and prevention. It is important to understand the facts. HIV affects anyone, women, men, straight, or LGBT. Treatment for HIV is highly effective and can potentially suppress the virus to the point where sexual transmission of HIV to a partner is unlikely as long as treatment continues. HIV commonly goes undiagnosed for years due to lack of presenting symptoms and unaware of HIV risk. 1 in 9 women are unaware of being HIV positive in 2016. In 2015, the median delay of diagnosis for HIV was 3 years. It is commonly misunderstood that women are not affected by HIV. However, women account for more than half of the 34 million people with known HIV diagnoses worldwide. In 2017, it was reported that women accounted for 7,401 of the newly diagnosed cases of HIV. Women additionally face an increased susceptibility to HIV infections due to the physiologic factors of the female reproductive tract. During sex, an inflammatory response happens, and when a sperm is introduced into the vagina, this inflammatory response can also increase a woman's susceptibility to HIV infections. Additionally, women face increased susceptibility due to HIV infections if they already have a STI present, such as gonorrhea or chlamydia. Women most commonly contract HIV through heterosexual intercourse. In 2017, 86% of the newly diagnosed HIV infections were caused from heterosexual intercourse. It is important to understand that everyone is at risk for HIV, so everyone should be tested. There are several different ways to prevent transmission of HIV. First, using a condom during sexual intercourse every time. Secondly, getting tested for HIV. Third, asking your provider about PrEP. According to CDC guidelines, individuals at risk for HIV without current active infections should begin on PrEP. Truvada is the only FDA-approved medication to prevent HIV. Before Truvada is initiated, patients must be screened for HIV and retested every 3 months to assure infection has not occurred. If HIV infection occurs, Truvada is discontinued as it is ineffective at treating HIV and to avoid resistance to this drug. Treatment options for HIV have improved drastically since the initial epidemic. Patients with known HIV infections are prescribed antiretrovirals to suppress the disease. Suppression of the viral load is possible if the medication regimen is followed consistently. This medication must be taken for the rest of the individual's life. If suppression occurs, transmission through sexual intercourse or from women to fetus is unlikely. Nurse practitioners in primary care settings can play a very important role in reducing HIV infections across the U.S. Encouraging to follow evidence-based guidelines for screenings in primary care is very important. Additionally, reducing stigma associated with HIV screenings and education, advocating for initiation of PrEP for those that are high risk, following treatment guidelines for HIV-positive patients, offering patients compassionate and non-discriminatory care, and providing with educational and emotional resources they may need. I hope that this presentation has been informative and has helped you understand how nurse practitioners can help prevent HIV infections. We play a very important role at reducing the number of infections across the nation. Early screening, testing, and early treatment can reduce the amount of HIV diagnosed, reduce transmission, and also reduce mortality and morbidity associated with the disease.